Hello, everyone, and welcome to the latest episode of the Raving Patients podcast. I'm actually using a new software, as many of you may know, and we are doing some video recording as well. So you're either watching it or you're listening to it. But welcome to the Raving Patients podcast. I'm your host, Dr. Len Tao, and today's episode is going to be titled How Insourcing or Remote Team Members Can Help You Reduce Your Costs and Grow Your Business. Recently, I did a podcast episode. Hopefully, you listened to it with Brenda McNulty from SupportDDS. Well, now we're going to speak to another individual from SupportDDS. He's actually the founder. His name is J.W. Oliver. So I'm excited to have JW on this podcast. So let me read JW's bio. And so J.W. Oliver is the managing partner of SupportDDS. His objective is to assist dental practices and DSOs to leverage growth, increase productivity, manage costs, and free up time utilizing virtual or remote teams. As a proudly Christian-based business, SupportDDS believes in the win-win-win philosophy. A win for the business as we reduce payroll costs and end the frustration of hiring process. A win for the new team member as they move into a more active workforce in a country where unemployment is estimated as high as 80%. A win for Christian ministries around the globe as we contribute 51% of all profits to ministries worldwide. As an entrepreneur since the age of 12 selling Pop Rocks, I know what those are, from his middle school locker, JW has started up more than 20 companies, from an insourcing center in Africa and dental imaging company to a collegiate summer baseball team and even a skateboard park. He is an avid traveler who enjoys seeing the world and sees an opportunity in every obstacle. JW has completed 2 half Ironman races, 10 half marathons, hiked 6 days from Cusco to Machu Picchu, all after the age of 48. He is a pilot, ordained minister, author, and podcast host. He loves to see others laugh and smile and desires most of all to lift up and encourage others and show them Jesus. So please welcome J.W. Oliver to the Raving Patients podcast.
Excited to be on. Thanks for having me. It's always great to be on cool podcasts like this as well.
Well, I appreciate you finding the time today to do this. And I know we were talking about how cold it is in Dallas right now. So I'm in Florida. It's about 82 degrees right now, going up to about 85. And you're in Florida. You're in Texas, Dallas, around. And you said it could go down to low as -2. So that's temperatures that obviously people haven't seen before, as you said, in the Dallas area. Um, so JW, thanks for coming on and speaking to me. I did speak with Brenda a couple weeks back, so her episode is probably live at this point. So to begin with, why don't you kind of expand on your bio a little bit? You obviously have done a lot of things in your life, and expand on your bio a little bit. Tell people a little bit about SupportDDS, and then we can jump into some of the content that we wanted to get to today.
Okay. Yeah. Well, yeah. Very fortunate. I grew up in a split home, but we had a lot of love in our home, and we grew up very, very poor. And I'm actually thankful for that now. I probably wasn't thankful for it then, and so I got to see lots of different sides from what it meant to really be in a situation economically that was tough. And I always remember saying I didn't want to end up like that. So realized through hard work and obviously through the country that we live in, if we work hard, we can come out of any situation and aspire to higher levels. Um, a little bit of background on our company. I've been in the dental equipment business since the late 80s, still have that company as well. And about 5 years ago, I was at a conference in Curacao, where National Center for Fathering. Strange set of coincidences. I met my current partner, who's from Zimbabwe, where our offices is. He's a big commercial real estate developer, and we started talking about how we could get together. You mentioned about the 80% unemployment. Uh, it was interesting. The people there speak perfect English. They sound like they're from the UK. They work hard. They have high degrees, a high level of college education or university education based on a British system. So, we coupled that and said, hey, what can we do? And started off with a variety of businesses, and we still have it under our ZimWorks company. But when we began with the SupportDDS, which has really taken off and been a real blessing to be a part of as well in this industry. So a little bit by coincidence that we ended up where we are today. It's kind of strange to say that I frequent going to Africa 3 to 4 times a year as well.
Yeah, that's one place I actually have never been fortunate to visit. I travel a lot for many reasons, but not to Africa. So at some point, it's on my well, I guess you would call it my bucket list. So at some point, we'll get over to Africa and check out what's going on
You
there.
can go with me. We can go together. That'd be great. You
Well,
can
that would
see
be
our
that
facilities. Yeah, that'd be a great place to go.
that would be cool. That would be cool. So obviously, COVID has really affected the way businesses operate, especially in the dental space. I was telling Brenda that I could not find employees because I had some employees of mine. I have a small office, but two of my employees, one had to take a medical leave during COVID. Another one wanted to take part-time job status at the office, and just trying to replace them was nearly impossible. I was not able to get any assistance at all. Nobody was responding to any type of job offers I had out there. So that's really affected how businesses operate. I'm sure that's helped your business immensely. So why don't you kind of, for those that are a little bit unaware of how your company works, why don't you educate the listeners so they can learn more about what Support TDS does from a remote perspective?
Yeah, I think there's a lots of ways that people look at it, but a lot of people review outsourcing or remote workers or offshoring as, I've got this person, they're typically going to be in the Philippines or maybe in India. They're going to work for me and provide what they believe is a low level position. That's kind of a misnomer. They can be hired for contract work. There's all kinds of good portals out there from Upwork to Fiverr where you can get certain tasks done. We're different from that in that what we're doing is we're a connector. So we call it insourcing because what we're doing is we're providing full-time dedicated staff members who work only for you. So, Lynn, if we hire someone to work in your office and you're wanting them to handle, insurance verifications and claims, or maybe help you with your social media, or maybe help you with scheduling, whatever that is, they work for you. So it's the same person. If Melody works in for you, you're speaking to her every day. You've got a direct line. We can integrate into your VoIP system. So we call it insourcing, and the reason we do is we know that they become part of your office, part of your team, and that's probably the key to it is making sure that they become part of your team. They really get enveloped into your culture, and then they become just almost a part of your day-to-day operation. So that's where we're different in that we don't do piecemeal work. It's we're not handling just one task that maybe it's not just insurance verifications, but you get to utilize them during that 40-hour work week.
Yeah, so that was one thing that Brenda had said on the call that I had with her was that these employees are working with you 40 hours. They are, you can get them to really do anything you need from a remote status. So it's nice to hear that there are options here because, as a dentist, I have a company that's doing remote, insurance billing. I have a
Sure.
company that's doing, remote phone calls. So they handle phone calls remotely for me after hours. So obviously, when you hire all these services, you're more than likely going to pay more than just hiring one individual to work, 40 hours a week for you in your practice. So I think that there's definitely a need in the industry, and I'm sure you see that because you mentioned you have a lot of growth, and that's really good to see. So, what are the most common for people listening who are saying, maybe I can use somebody for, as you call it, insourcing? What are some of the most common tasks that they're taking care of in the office? Because people think they're not going to use someone effectively, but I mean they do a wide range of things for you. Obviously, or they can do a wide range of things for you. So you know, pick out some of the most common tasks that they're doing when they're working for a dentist full time.
Yeah, the number one question we get, which is always a hot topic, is the insurance verification and insurance collections. That is a big piece that, as when you kind of went back to our motto, it's elevating your team. When we talk about elevating your team, we see that there's practices who have really talented people working in their front office, whether it's an office manager or it's the front desk person, who end up being on the phone. And these calls can take 25 to 40 minutes each, trying to pre-verify insurance. So when when your patient comes in, they know what their coverages are, and so we try to take that out of the front office. So you mentioned the things they can do. We've got Obviously, I mentioned insurance verification. There's people doing hygiene recare programs, following up on unscheduled treatments. I read recently where like the average office has over $500,000 of unscheduled treatment plans that they've laid out. Maybe they just haven't followed up with them. Reactivation of patients, those that haven't been in 18 plus months for a hygiene visit. It's appointment confirmations. There's a lot of automate, and a lot of these have automated tools, patient care follow up, scheduling. We even just did a short-term program for a very large DSO in the fall. It was about a 5-month program where they were just trying to fill their schedules. They said, we had a lot of cancellations and we were trying to fill up a lot of things from the COVID. And we said, hey, how do we fill those up? So they did an outbound campaign, and they've actually decided to stay with us in doing that campaign. So there's a number of tasks that they can do, and then it becomes kind of open for what else. And the nice thing about it is, again, there are companies that do this. There's lots of companies doing verifications. There's lots of places that'll do your scheduling and your calling. What this is we see this as an extension of your office, rather than just a company that does a piece of a work for your contract work.
So it sounds like most of the things they're doing are over the phone, obviously.
Sure.
Is there things that are not phone based that they can still do being remote?
Oh yeah, we've got a lot of them who are doing, as an example, accounting functions. We have some people who are doing nothing but assistance to. Matter of fact, we've got a mid-sized DSO right now that just hired a person to be their CFO, and so it's a remote person who they realized, what, we're doing this. And this was really all the advent of the COVID scene, right? You had people who weren't familiar with remote workers, and then everybody went home to work, and they said, wait a minute, this works. And so even a high level position, and to give you an example of that one, it's a little bit unusual, but we've got a few like that. This was a $150,000 position they were trying to hire, and they were able to hire it for about 40% that rate and feel like they can get the same result. So yeah, there's a lot of behind the scenes things that can be done, data entry, social media. We've got a lot of people that, offices that'll say, what, I need some relevant material being posted about us 2 times a week. And you know how that works. So you're in that sphere as well. That's just hard sometimes to come up with content. Or, what, if the doctor says, man, it's been like 3 weeks since I posted anything on my social media, or my website changes. And so we've got a lot of offices who are using this for kind of a semi marketing as well.
So, when somebody hires you and you obviously find someone that would probably fit their needs per se, how long does it take to get that person ramped up to where they're fairly comfortable working in the office or with the
Yeah, we
office?
we've got a basic training program we put them through. You mentioned Brenda. Brenda kind of oversees some of that training to make sure that the content. She's been in dental consulting for 20 plus years, so we wanted to make sure that the content was right. So we've got a really good program that we keep about 10 of the what we call dental team members who are ready to go. So they get this basic understanding of insurance verifications and customer service. They do some basic courses and all of this, but we tell people that this is, although we give them the basic training, every office operates a little different. Your office is going to operate different than the one across the street. That with So from the time you say you're ready to hire somebody and you do the interviewing, and we allow you to do the interview to pick the person you like the most, we'll take the top two or three and you work on that. But the next step, usually from the time you interview to the time you hire, it can be as short as 5 days. But from that point, we say give it a good 30 days while you integrate them into your office. You bring them into your culture and you train them on what they need to do.
Gotcha. That makes sense. So, let's talk about, and I want to hit on some of the I guess we can call it some of the ways that you give back. Okay. So, one of the big things is I mentioned in your bio is you're taking, a person who is, I would assume, unemployed, and then you're bringing them into a position where you're getting employed, or they're getting employment, I should say. and you put them in the active workforce in a country where you say that unemployment is as high as 80%. So, can you talk to people about that a little bit and really understand the cause that you're giving back to?
Yeah, we call it the win-win-win, and it truly is. You hear win-win, you hear win-win-win, and all people have different definitions. But when we look at it, we say it's a win for the person who's getting a really solid team member. So the person that, let's say in your office, Lynn, if you hired somebody, you would have a really solid person. So that's the first one. The second win is that the team member who is getting this job is able, in a lot of countries like this, especially Zimbabwe, that job not only provides typically for them and their family, but could even be the extended family. As we were going through COVID, we even had outreach programs where we were feeding 300 families outside of our workspace because there was some real need to be able to provide for food subsidies at that time. But just these jobs will typically provide for their family and their extended family. So it really changes everything that they've got going on. You have these educated people. There's just typically no jobs that they can get involved in. So this provides them a good job, and I will say that the environment they work in is a step up. We're in a high rise building in downtown Harare, and so they're able to come to a Class A building with high-speed internet. We have air conditioning in the building. Very, Brent, we just remodeled an additional floor. These are all new facilities. Very, they're very proud to be a part of what we're doing as well.
So they actually work in like a call center. Is that what they're doing? They're working in a. They're not working from home. Then they're working at. They actually go to a place to work and they work within the facility.
Yeah, we have had a few situations where somebody could work from home, but obviously in countries like this, you've got unreliable internet in these rural areas. You may have they have they have power cuts, right? And they'll just have power cuts where their home power's gone. We've got access to power 100% of the time that we have, and we have backup generators in the system if that it runs the whole building if we had to. But typically we're able to be able to provide for those things that they could. So yeah, so they come to our office. One of the cool things, Lynn, that we do that's quite different is when my partner and I decided to do this, we really said, okay, we both have different other careers that provide for our basic needs and families. We said, how can we give back? And so we said, hey, we're going to give 51% of our business to the Lord. We're going to let Him sort out the direction. And so we have things in our office that are different. We have a pastoral care team. We've got two full-time pastors that work there that provide when people are going through, especially during this COVID time, right? They were going through depression, and a lot of family members were lost. A lot of elderly family members were lost, and so we've got a full pastoral care team. They have access to health care. There's no free health care there, so all of our team members have access, and it literally has no deductible, so they can go to the doctor when they need to. They can get medication when they need to. So these are things that we felt like were just important to make part of that culture as well.
Now, the 80% unemployment is pretty astonishing. So, can you again, for someone who doesn't know a lot about Zimbabwe, and I'm not sure a lot of people listening would know a lot about Zimbabwe, um, can you talk to the reasons why unemployment is as high as 80% potentially? I actually, prior to the call, I did do a little bit of research. I read that there's a lot of street vendors there. They're full of street
Yeah,
vendors.
yeah.
So I did know that. So I don't want to say I don't know anything. But can you kind of just touch on why the unemployment is so high versus other, let's say, other countries also in Africa?
You know, Zimbabwe is well. First of all, I love Zimbabwe now. The people are just unbelievable. They're very compassionate. They're very peaceful. They're very they want to do a good job. They want to please you. They want to work. But if you look at the history of Zimbabwe, which was formerly Rhodesia, there was a up until the late 70s they were the number one country. They were the breadbasket of Africa. There's 54 countries there. They were the breadbasket. They had the highest export of crops, things like corn and tobacco. The mining is tops in Africa in terms of a lot of precious metals. And so they had all these things going for them. And then in the late 70s, there was a kind of an overthrow of the government, if you will, and a gentleman by the name of Robert Mugabe, who since passed away just fairly recently, was in power for almost 40 years. And he since about 2 years ago, they've had a new president came in, and they were really have been under quite duress, more of what we would see in Cuba, and where the government controlled everything. The government was in charge of kind of leading the way, and there's been some great changes here in the last few years. I think Mugabe had a great was a great leader for his time, and now there is a point where it's making a new transition to become more of a true democracy. But what it's left just there was land grabs that happened in the 2000s where the government physically took land from a lot of the white population, and they were doled out to people to give to them. And these were farmers who lost land and they didn't know how to farm, so now they have basically zero export of staples. And so now there's lots of street vendors, as you mentioned. There's what they call the informal sector, as they call it, and you've got a huge informal sector that are just reselling soaps and goods and fruits and vegetables on the street with no permits. But they can't really control that, nor do they want to, because obviously there's a need to allow people to work and be able to eat too.
Are those people considered employed or unemployed if they're just a street vendor then?
Well, since there's no official way probably to count them, I know they do use a number to say that that's part of the employment. Whether that's low or high, I really don't know. But there is a massive, most of the time when you speak to a family, you'll find that most of them are unemployed, or they're working some day labor type jobs, or maybe a certain project that'll last for a month or something.
Gotcha. So I think someone may be listening to this. Why Zimbabwe? Why there's obviously lots of other countries. I understand that they speak very very good English. They've got the English accent or British accent, I guess you can say. So why pick Zimbabwe? How does that compare to some other countries in general with what you're doing? And again, why Zimbabwe versus some other countries?
Yeah, well, no doubt. I believe it was definitely God inspired that I brought myself and my partner Ken together. And Ken's he's a born and bred Zimbabwean. His family grew up there. He was born and raised there, and so that was obviously the reason we went into it. But as I was very very skeptical, and I said, let me try this with our company. I had used remote workers in my dental equipment business. I said, let's try that first. I hired two to begin with, and I expanded to 4 or 5. And today our dental equipment company has about 15 people working there in all kinds of accounting and support roles and logistics and very even sales roles from that outlet. So I realized quickly that not only were they very talented and educated, but the English was a big determining factor, right? I mean, you didn't have an accent. You've called call centers before, and you think, what did they just say? I didn't understand what they just said, or the broken English. Hey, Lynn, I'm here to make you happy. It's like, no, 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 no. You're here to solve my problem. And so I instantly saw that they didn't have that type of a cultural differentiation. And then we saw the ministry opportunity. This was an opportunity to really put people to work, and that was really the game changer for me. Not saying that there's not other countries that would work. They're in the way they divide Africa up. There's the francophone and the anglophone, and there's different little dialects that they speak, and there's some right there in the middle. Through South Africa, where it's English speaking, and I think we just found a really good target that people were not only educated but they wanted to work too.
Gotcha. Something that you mentioned prior to this conversation we're having now. You mentioned how COVID really have changed the way we do things remotely, and people didn't realize that a lot of things can be done remotely that they didn't do. So it's funny. I work for Bird Eye, And Bird Eye hired employees only in Dallas because they're based in Irving, or in Palo Alto where they're also have another home office. And now the entire company is remote. I mean, they're hiring people all over the country. The meetings are all happening on Zoom. I think they're actually not keeping their Palo Alto office right now, just because it's up for release renewal, I think. So obviously, things have really changed the way we do business, and obviously, this has really allowed you to show how good an employee can work remotely for a dental office. Because honestly, a year ago, 2 years ago, 3 years ago, this was not as common as it is now. So I think we say that, COVID wasn't good for certain reasons. In this case, COVID was good because it proved that someone can work remotely and be very effective in doing it.
Yeah, that's an interesting point, Lynn. I mean, the one thing that we knew it worked, right? We had experience, we saw it working, and the ones that took a chance on it. But especially in the dental world where everybody's in your office, right? I mean, those people work in your office. You wanted them sitting at your desk, you wanted to be able to maintain them. And there was a lot of skepticism about that. But if I'm very much an optimist, and the glass is half full, not half empty. And I look back at COVID and say, for us, I'm not going to say COVID's a blessing, but I'll say some of the things that came out of COVID were a blessing, because it did open people's eyes to the ability to use things like Zoom or Microsoft Teams or whatever format they're using. And that was not known. I mean, you know this as well. There's large companies. You mentioned Bird Eye. I've got a friend that works for PayPal in one of their big operation centers, and they're saying, hey, we're not going back to the office. We've realized that not only can we do this, but many of our team members are more productive by working at home, where they're seeing that their productivity levels are higher. So yeah, it did bring an awareness, that tasks that you thought could not be done remotely can be done remotely.
Yeah. Now, I happen to be Jewish, so I'm not into the whole Christian understanding. It's just not who I am. So talk about how that you contribute 51%. I really wanted to make this more about how you give back to things rather than
Sure.
exactly what you do. So please understand that. You give 51% of your profits to ministries worldwide. So talk about how that came into place. Because we hear about these companies out there that do that, and they're on TV. Shark Tank. There's companies obviously who give back a lot to different charities. So talk about where that whole idea came from.
Yeah, well, and first of all, Israel is my favorite country to visit by bar none. I've been three times. I was headed again this last year when COVID hit, and so, I think the cool thing is uh, uh, Jewish and Christian believers definitely believe in the same God and believe in the same direction. There's a little split there with Jesus, but we can reconcile that later on. Uh, but definitely, we know that the Jewish nation, and I want to make that clear, that they are the chosen people, and we need to always remember that as well. There's a reason for that protection over Israel. But yeah, so when my partner and I both got into this, we both being believers, we were actually at a Christian conference when this happened, when we met. And so as we were formulating, of course, for many years we were losing money trying to grow and expand, and we've been blessed this last year, and begun to be profitable. And we both said, look, we want this. We looked at it as if we truly believe that God runs everything and God is in control, then we said, okay, well, let's let him control our business and let's let him be the majority owner of it. So we've actually got some documentation that we've included in our bylaws where we're going to give 51% to ministries, and we're very active. We look at ministries in three areas. If you look on our website under our ministry section, we talk about ministry within our own team members. So we want to start with them, those in Africa first, when they're going through difficult times, if we can contribute back. So we see the team members as the first place. Secondly, we look at the community that we're in. So that would be in Zimbabwe or Harare specifically, which is about 3 million people. There's lots of areas there that we do outreach. We've dug and drilled water wells. We've supported 300 families during the COVID time. And we've tried to do that. And then we do a lot of things on an international basis. Global Action is a group I serve on the board, and we contribute to that as well, which their job is to train leaders in hard to reach places to basically change their community. So that's kind of where we see that as three phases. Again, our team locally and then worldwide, but how we can use that to make an impact. And then we really try to, I forget the why we do things. You talk about the who, what, the how, or the why, and the why we do things is really important, because most of the times when I'm talking like to you, if I was pitching our business to you and your dental practice, many times I forget the why we do it. And when I'm able to share that with you and say, oh, hey, by the way, Lynn, one of the things we do is we give 51% back. Most people are like, oh my good, now I get to be part of a ministry, because a portion of what I'm doing is actually going to help. So a lot of, especially dentists who are busy and they maybe can't go out in the mission field and serve, realize that this is an opportunity for them to be able to support a missions too through their business.
No, I mean, like I said, I think that was one of the main things I wanted to get out of this was, why you're doing it rather than what you're actually doing,
Yep.
because, I think that this was a whole different take on things. So, you know, can you talk about some of the benefits? We already talked about it. It's a remote worker, but from a practice perspective, a dentist is listening to this, an office manager is listening to this podcast, and they say, what are truly the benefits of having you work for them or somebody from your company work for them? There's going to be some cost savings, as you mentioned. I think some practices may debate that depending on who they're going to hire and the price they're hiring them at. So can you talk about some of the benefits of using a product like yours and comparatively, what it's replacing in that sense?
Yeah. I think, number one, you have to look at we've done a lot of research, and let's just take somebody, if you brought them in, paying them, let's say you had an office person that you're going to save $40,000 a year. I'll just use a number. Most people don't calculate in the FICA matching. They don't calculate in the office space in which they actually take up. Do they have to have a desk, a computer, all the hardware? Not only that, the vacation days each year, maybe the earn time days. There could be health insurance costs. There's a lot of these other costs. Most people will say that's about 40 to 50% on top of your salary. So you take a $40,000 worker, that in reality that could be closer to 55 to $60,000 a year in real dollars that you're spending. And in that case, we know we're going to be in the 30 to 35% of the cost. So a 65 to 70% savings. So there really is a real cost benefit. Most people just go, well, I'm only paying this person $12 an hour, and yours is coming out to be $10.36 an hour. Well, it's more than 12. Your cost to us at $10 an hour is a hard cost, and it doesn't go over that. Your cost within your office, and you know this from a dental office. Sometimes it's just dealing with the personalities within an office. You also eliminate having another gossip center or another personality that has to be dealt with because they are remote. You typically don't have that in your office, so no, less disruptions, I would say. Uh, but really, the buy-in becomes where we try to target people who have the heart for ministry as well. So not only do they say, hey, I can say, well, let's just say it's only 50%, or maybe it's only 40%. They're saying, I'm only going to save myself 40%, so that's not a big deal, or is it a big deal? But then you really advocate what you're doing in the ministry, and it allows people to be a part of that as well.
Gotcha. So talk about, and I know we didn't talk about it, and we're gonna, get to some more information about your actual, cost and stuff. But talk about the cost. I mean, I know one of the questions I actually asked, excuse me, before that I asked Brenda was, what if you don't need an employee full time? So that's always something a dentist may be thinking. I don't need someone for 40 hours a week. So that was one thing I wanted to ask you, and then I'll follow up with another question in a second.
Okay. Yeah, we just have. Matter of fact, by the time this airs, we'll have it all ironed out. We don't promote it on a large scale, but we've got We do have what's called a support services group now. And what that is, that may be somebody who says, you know what, I'm a real small practice. I just need them to do insurance verifications and I need them for 20 hours a month. This is all I need them. So we've got a program where it's a minimum of $300 a month and you're going to get it basically at a cost of about $14 an hour. So let's say you need 20 hours, that's going to cost you somewhere around 280. We got a minimum of 300, so you're at that 300 mark, and you say, oh, okay, well, great, I get 20 hours a month. I just need to use them for these specific tasks. You may not always have the same person, but it's probably going to be on a rotating group of 4 or 5 that are familiar with your practice and know what you need done. So we've recently tweaked that because we've had it we didn't want to get out of our model, but we realized there was a lot of smaller practices that said, look, I just need this for, 20 hours a week or 10 hours a week. So we think we've kind of filled that loophole as well.
No, I think that's something that's definitely sounds more appetizing to some of the practices because I'm only open 25 hours a week. Now I know they would work other hours, but to find someone, my whole team doesn't get 40 hours a week. Um,
Yeah.
so that was one question I had. And then, so talk about a full time employee, talk about the cost, talk about, that process as well. So you have a full time employee, 40 hours a week you're giving them. Talk about the cost for those individuals.
Okay. Yeah. A full-time trained, dental staff member, and when I say trained, let's say you use Open Dental, we'll actually spend. We have an onboarding specialist who would actually be the liaison to see that okay, they use Open Dental. So first of all, we're going to pre-train them with some. Open Dental's got a great set of videos on processes, so we'll make sure they go through the videos and be pre-trained, and then we'll come to you and say, okay, let's say we're speaking to your office manager, and we say, okay, how do you want them to book these insurance verifications? You want them on long form, you want them on short form. So we try to integrate them into that where they really are completely capable. And then secondly, it's a flat rate of 1850, so it's 1,850 a month. I said that to somebody the other day, and they said, "Well, that's 92,000 a year." I said, "What are you talking about?" He goes, "I thought you said per week," and I said, "Oh no, that's per month." So that wouldn't be a very good savings if it was per week. So 1850 a month, that's all in. That's paid to our company in Texas. We've got an LLC that's based in Texas, and then we have a sister company there in Zimbabwe. So we handle all of the HR, we handle all of the IT, all of the we get the pastoral care, the benefits, all that's handled from our Zimbabwe company, and so you pay a flat fee to our Texas-based company.
Yeah, so I mean, just for people who are thinking about what that costs and don't have a calculator or don't, so the 1850 per month is $22,200 annually. So that is a relatively even if you're working 25 hours a week, you're talking about it's only not that much money an hour.
Yeah,
So
yeah.
you're not really losing a ton of money there by hiring someone like you to handle um, uh, those tasks in the office. So I think that's actually sounds better. I think I was actually when I interviewed Brenda, I think I was thinking about different numbers here for some reason, even though she was pretty clear. I just looked at it differently. So it comes back now. It sounds like it's actually a very good option when you look at all the benefits and the costs that you will be saving by
Well,
having an
Lynn,
employee for that.
and I'll jump in right there just real quick. I mean, we've got a couple of offices that have been, well, one of them been with us 3 years, and they said, she only works about 28 to 30 hours a week, but it's fine because those are tasks that we no longer deal with in our office. She comes to our Wednesday morning team huddle. She's involved with our processes, and then we don't worry about that anymore. So you're right. Even if you break it down to 25 hours a week, well, yeah, that's probably $18 an hour, but there's no other benefits, there's no other costs. But if you do it at 40 hours, it comes out to be about 10.50 an hour or so that you're actually paying for those 40 hours a week.
Yeah, that actually sounds a lot more. Like I said, I was thinking of something. I guess I was thinking 1850 a week too when Brenda was because you mentioned that.
Okay, yeah,
I
yeah,
think that's what
yeah.
my
That's
mind thought.
that's expensive.
Yeah,
That's expensive. Yeah.
it was like $46 an hour. I'm like, I don't. I'm glad I relooked at those numbers.
Well, and keep in mind, I think something to remember. There's, as you know, well, we talked a little bit about it before. There's a big push to go to $15 an hour as a minimum wage,
Yeah,
and we're not going to have to do that. We're contracting in that country. So, I think if people will do a little advanced planning, because it looks like it's coming in some form or another, a big push to that. And now your office staff is not going to be 15; they're going to be $25 an hour. So there's definitely going to be some different comparisons.
Yeah, and it's funny you mentioned about the minimum wage. There's been some questions in a lot of the Facebook groups about what the $15 minimum wage is going to do to our team members. Are they going to want to ask for more money? So obviously, again, you have a fallback option to hire someone remote at the front desk to handle some of these tasks, and it's you're for 40 hours a week. It's about 11.50 an hour is what I calculated it at. So you're definitely well below that minimum wage. No option if that ever kicks in. Not that I have anybody in my office getting minimum wage. Um, so, um, so why don't you mention or let the listeners know or viewers how they can find out more information? Contact you or contact Brenda or whoever to contact to get more information about what you do and how you do it.
Yeah, you can go to our website. It's just supportdds.com. We've got information on there. There's a place right at the top where you can sign up, submit your email, and we'll send you some information or have somebody contact you. You can call the number on supportdds.com direct, and we'll be happy to take your call and give you some information. We've got a place there you can set up on our website to do to schedule a call at a time specific for you, and one of myself or Brenda or Rob or somebody will actually get back with you. And what I encourage people to do the phone call, because we can give you a better understanding. Although if you listen to this whole thing, you got a pretty good understanding of what we do. But I encourage people to go through an interview. There's no obligation, and I say, you know what? Interview two people. You speak to them. You ask them questions. Spend 20, 30 minutes with each person. So block you out an hour and interview two or three people, and then you make the decision. There's still no obligation for you to do anything, but at that point, you'll be able to say, "Huh, does this work for me?" And Lynn, no doubt. I mean, you're involved with Bird Eye and a lot of other companies. We actually are a solution. There's a lot of dentists who are involved in other companies or have other businesses. We definitely are a solution when it comes to marketing. We've got one of our DSOs that has five IT people that work for them, so they're doing remote IT work for their DSO. So you just kind of have to expand your mind about what role we can fill as well.
Yeah, that definitely makes sense. So I wanted to thank you, JW, for joining me on this episode, kind of educating the listeners and viewers about a little bit about what Support DDS can do and how you do things. Guys, if you want more information on using as we called it, as JW called it, an insourcing support rep, please reach out. Please reach out, and you can listen to Brenda's podcast as well if you haven't already. If you like the episode, please share it. Please let the other dentists know about the Raving Patients podcast. Remember, I have a Raving Patients Facebook group, so feel free to join that as well. And again, JW, thanks again for joining me. And as I always end these podcasts, remember, your reputation matters. Till the next episode, JW, thanks for joining me, and have a great day.
Thank you.